Dr. Bharat Pankhania joins us now from Bath in England. He's a senior clinical lecturer at the University of Exeter's Medical School, over 25 years experience in advising on communicable disease control and infectious disease management. Doctor, thank you again for your time. I don't quite know where to start, so I'll give you the very latest from Beijing. This was from the Chinese government just a few minutes ago, and it's calling on the World Health Organization to take what it calls a just position on COVID-19 after the WHO criticized Beijing's very narrow definition of how to classify a death by COVID-19. Why isn't China giving all the information that the whole world needs to stay safe?
I suppose it's all about face saving. China was an exemplar of, look, this is how you manage it, meaning our zero COVID policy is the best. And China, fair play to them, did really well with its test, trace, contain policy before the vaccines were invented. However, since early December, when they've done a U-turn, this is big mismanagement by China. And of course, it is a case of face saving. They don't want to wash their dirty linen in the global public.
What's the best way for other countries to stay safe? And we've just put the EU's position there about testing before arrival. But the thing is, people from China have been traveling already before the restrictions are going to be lifted on the 8th of this month. But if they traveled, when they went back to China, they had to quarantine. After the 8th of January, they won't have to do that. So 2 planes just a few days ago from China arrived in Italy. The Italians decided, okay, let's test everybody. 50% of passengers on those 2 planes were infected. So how do we stay safe considering what's happening in China?
So the good news there is that Western Europe, Northern America, etc., have been using the mRNA vaccines and boosting. So our population in Europe and North America is pretty immune or has been exposed to this virus before, and therefore we're in a very good position. Furthermore, we've been looking at variants arising from China and elsewhere. And the good news also there is that what is circulating in China is already circulating in Europe and Northern Americas. So far, so good. The surge in number of cases in China is going to be a problem for the Chinese population big time. But that surge of cases isn't necessarily going to affect Europe or Northern America.
Yeah, you mentioned Omicron and possible immunity. The latest research I've seen, and I'm sure you've seen it as well, it said actually that Omicron, if you get it, doesn't even provide immunity against itself. And then it was talking about the effectiveness of the vaccines in trying to stop the severity of Omicron, and that it's not particularly effective at that either. It may be that Omicron itself, as you've said, is for most people mild anyway as a strain. But what about the future prospects of a different strain that is not going to consider any sort of immunity against a previous infection because, again, of what's happening in China?
So with respect to a huge variant arising from China or anywhere else in the world, it may, and the operative word is may, be a setback. But again, we can take comfort. The comfort we can take is now that we know our mRNA vaccines work, we can very quickly reformulate that vaccine to mirror the new variant that has started to circulate and start to protect the population. So again, I repeat, people who are using the mRNA vaccines are in a much better place.
Very briefly, Doctor, if you don't mind, I've asked you this question probably a dozen times, and you're talking about mRNA vaccines. If those companies were to release their patents, the intellectual property rights that they have over their mRNA products, that would help China. So why don't they just do it?
I think it is not a case of it will help China. China has been reluctant to just use those mRNA vaccines because it wishes to use its own made in China vaccines. So if China were to knock on the door of Pfizer, Moderna, AstraZeneca, Oxford and said, can we have your vaccines? I'm sure those companies are not going to say no. It really is a case of China resisting the use of these mRNA vaccines because it wants to use its own made in China vaccines.
Certainly been the case so far, hasn't it? Dr. Bharat Pankhania, you know how much we appreciate it always. Thank you so much indeed.
My pleasure. Thank you.